In this video, I am going over some common questions with infertility and irregular cycles. So let's answer them. Okay, the first question we got was, can miscarriages cause irregular cycles? And yes, they can. And I always tell women, definitely be in contact with your OBGYN throughout this whole process, from miscarriages to obviously if you're trying for a baby, to make sure that you're on track. But definitely for the first couple months of after having a miscarriage, your cycle can be really, really weird. So definitely give your body that grace in that aspect. But I'm so passionate about making sure you are digging for the root cause. Every single infertile woman that has come through to our practice, they've done all the typical testing with their OBGYN. I recommend that definitely being one of the first places that you do go. But when we start looking deeper into root causes of what's really going on, we're starting to see like there's adrenal issues, there's blood sugar issues, there's gut infections, there's all these different things that can be easily supported with diet and lifestyle. Definitely make sure you check that out before you start trying to get pregnant again, because as you know, you kind of want to be in the best health possible before you start having a baby. So this is a great time in your journey to make sure that you are checking out all the things and really getting that in-depth lab work if you keep having reoccurring miscarriages. The next question is, how do you track irregular cycles? This is really hard because sometimes ovulation's all over the place. Sometimes it's longer than what you expected, shorter, you don't do it, which is called an anovulatory cycle. It can get really overwhelming. So the first thing you can do is, there's obviously the ovulation trackers you can pick up at Target or Amazon. You can also track your discharge, tracking through it. You'll have little mini seasons of it being dry, of it being like that raw egg white, making sure that you're tracking your discharge. Also taking note of higher libido. Usually when you're feeling more in the mood, that's usually around ovulation time as well. Taking your BBT, your basal body temperature. There's Daisy thermometers. There's lots of thermometers and apps that you can use to track this as well. And of course, ovulation pain, which can be like a dull ache in your ovaries. Anytime you have pain, I do want you to go check out with your doctor, make sure it's nothing more serious, but having some ovulation pain does occur in women, and that can kind of trigger them to be like, I'm ovulating. And you usually know which ovary that you're ovulating from. I would also recommend finding an app that you really love. I think I used Glow a long time ago. I think apps have come a long way, so I don't have any specific ones. I just use the Apple one in the health Apple products now, and it's just tracking more so like my cycle, and you can track symptoms in there too, and ovulation, which is a pretty simple one, but I know that there's more apps that are really in depth, so you can make sure that you have one that you trust. And if you wanted to get nitty gritty into the testing, I would recommend a Dutch test, which is a dried urine hormone test. It's one of our favorites, but there's actually a type of Dutch test. There's Dutch Complete, which is mostly what we use, and it tests your sex hormones and adrenals. You take it after ovulation. So I am someone who recommends taking ovulation test strips until you get that positive, and then waiting a couple more days and then taking your test. But if you are just literally have no idea, there is one that is called cycle mapping. So you have tons of strips that you pee on. And I've actually done this, and I would think I was so tired of peeing on strips. By the end of it, I was like, yeah, I'm definitely just doing this once. I just wanted to experience it though. And so you get strips to pee on, and they give you the days, like days 1, 3, 7. I don't know exactly, I don't have it memorized, but you just pee on those days of your cycle. And that way it tracks your hormones all month. So even if you're having like a 40-day cycle or whatnot, like you can just pee. And that way, when you get that test back, you can see exactly where your hormones are at, your estrogen, your progesterone, where it's peaking, where it's not peaking, how long your follicular phase is, which is the first half, or how long your second half, which is your luteal phase. So I love it. I think if you are really struggling with understanding what is going on with your hormones, this is a great test. It just feels like you're peeing on things forever, but it's really cool insight. Now, a big question is, can I get pregnant with irregular cycles? Yes, you can. It's just harder because you don't have that regular, well-known, I ovulate on the 15th of every month. It's just all over the place. So it's harder, but it's not impossible. And I encourage that if you really are having irregular cycles, I would highly recommend deep diving into your root causes of why you're having an irregular cycle first before pregnancy. Like, I wouldn't want to try to jump into it when your hormones are kind of wonky, because then who knows, you might be at higher risk for miscarriages. Like, I don't like overlooking those things. So I would take a pause. Let's check out on some root causes before trying to get pregnant. But you can get pregnant if you do have irregular cycles. I know there's a rule of thumb of testing for pregnancy 15 to 20 days after you had sex to see if you got pregnant from that sexual encounter, of maybe when you thought you were ovulating. But again, like, I'm such a fan of like testing. Let's get down to the bottom of it so we can get regular cycles, and then you can get pregnant without the stress of like, I don't even know when I'm ovulating. Another question is, with irregular cycles, like, what does that look like after pregnancy? And this is a season of life that it's supposed to be just kind of crazy. Your estrogen and progesterone is changed, and especially if you're nursing and you're planning to just like breastfeed after, what that is going to do is that you're going to have increased levels of prolactin. That hormone is going to make that estrogen and progesterone off. And that's going to be for the duration of breastfeeding, because that's just the hormone that helps us lactate. So because of that, that's where the talk comes from of you can't get pregnant while you're breastfeeding. Well, obviously we know it's not true, because even while I'm breastfeeding, sometimes women can get their cycle. Sometimes women can be ovulating, even if they're breastfeeding. So do not take that as I'm breastfeeding, I'm safe, I can't get pregnant. No, definitely still use protection where needed if you are not ready for another one. Definitely allow your body so much grace. Like, don't look for perfection 2 months after you give birth, especially if you're breastfeeding. I know women who are breastfeeding, and honestly, they have no period and spend like a year and a half, and they're still nursing. If you are formula feeding, obviously that's a different story. You are more likely to get your period back pretty regularly shortly after, but again, give your body some grace. It grew a human for 9 months. So if it's really wonky at first, the first 3 cycles is like really weird, long, short, painful, not painful, like, let your body bounce back to where it was. And then the most famously common question is, how do you fix irregular cycles? Well, it just depends on where your root cause is. What's making you not have a period? What's making you delay ovulation? Is there a lot of stress? So is there some adrenal stuff? And then with stress, it's not just external stress, it's also internal stress. Do you have like chronic gut issues? Do you, is it a thyroid thing? Thyroid can impact your cycle. There's so many different reasons. Are you under eating? Are you over exercising? Like, there's so many things. And so we want to make that simple. We usually will focus on the foundations first with our clients. Those things of like, are you eating enough? How's your stress? Are you exercising too much? Like, what's your whole diet lifestyle? We'll make changes from there, and then we'll just build off and, come at it with priority of like, okay, maybe this is a lab testing that we need to do, but I promise, like, irregular cycles does not have to be your forever. There is so much that you can look in on and check out. And if you need us and you need support, we'd be happy to help you. Go to the link in the description that will bring you to our page that tells you all about our services and what we offer and how we help women, and then a form for you to fill out to get on my calendar if you're ready just to take your next steps and say, I need help. I'm ready to stop guessing. Like, I want regular cycles. I'm trying to get pregnant, or I just want regular cycles because I'm a woman and I want to know ideally around the time I'm going to have my period. Which I get you, that's really important. So go to the link in the description. I hope to see you and hop on the phone with you. And I hope you got some answers from our FAQ of irregular cycles and pregnancy.